So I'm pleased to be here at the South by Southwest Health and MedTech Expo, here with Jay Bernhardt from the Center for Health Communication at UT. This is a great opportunity as we're in this room filled with all these entrepreneurs and exciting things going on around health tech to think about, I think, something that often gets overlooked, and that's really health communications. And that's your specialty. Why don't you tell us a little bit about exactly what is health communications?
Sure, thanks, John. Health communications is the application of communication science and practice and theory and creativity to creating information and data that people can use to be healthier. And people, I mean individuals, so it's the information you receive and you send about your health. It's also families and organizations and information that they could send or receive about, like workplace health. Right. It's also community level engagement, community level listening, and community level messaging to help improve the health of large groups of people. And then finally, it's the role that communication plays in public policy. So as we design policies to help improve people's health and protect people and keep them safe, it's the role that communication plays to make people aware of those issues and as well as apply them and be more interested in them.
Yeah, it's fascinating, and I know your background is with the CDC, and you're thinking about health communications on a large scale. What's interesting about what's happening here in Austin and with the Dell Medical School in particular is we're thinking about how a health ecosystem takes shape. And I'm working in communications as well, and we've talked about this before, but I'd be interested to get your thoughts on how does health communication play a role in the creation of a health ecosystem? And I think about, we get to do this from scratch. So what are some ideas about how to do this right from the beginning?
Well, let me first start by saying that we're delighted to work with the Dell Medical School, and the Center for Health Communication really is delighted to be partners with you and Clay and everybody as we build and design this new health ecosystem. Some of the biggest problems we have in health in the US are coming from the fact that in some cases it's not enough access to care, in some cases it's we don't have the right data and we need to figure out ways to manage the system better, to put the right data into the right people's hands. And sometimes the problem is we just don't have really effective communication in the system. And that could be communication between doctors, it could be communication between and from doctors and patients, it could be communication in the community and engaging with people in the community. And and a big part of it too is listening. And it's the notion that medicine historically is very top down. It's the doctor is the expert and the patient is down here, and the doctor kind of talks down to the patient and says, you're sick, this is what's wrong with you, this is what you need to do. And in the new health ecosystem, information is exchanged in all different directions. And so the doctors and the caregivers and the new med students, as well as the whole system, listens to the people we work with and we're trying to help as much as we talk to them. So it truly, communication is the nervous system, within the health ecosystem, where the pulses that put the information back and forth, where the sensors, the eyes and the ears, especially the ears and the eyes of the healthcare system, to share information back before we talk, before we use our words to put information out there.
No, it makes a lot of sense. One of the things that you're making me think about is we this morning announced the new Design Institute for Health at the Dell Medical School, and we have some really creative guys coming to lead that, and one of the things they talked about was the fact that they're designers, but we're looking at the community to be co-designers from the very beginning. And I see health communications as a very similar kind of thing, really establishing a two-way stream of communication.
Yeah, I'm a really big fan of design thinking, and I think design thinking has shown in different industries how it can really revolutionize programs and solutions. And what's particularly unique about design thinking and design work is that it puts the customer, the client, the patient, right at the center. And it says, instead of saying, here's a solution for, we have an issue of lack of safe water in parts of the world. And what they did and what a lot of the design experts do is they go into those villages and they truly understand what are people's needs. Why do they need water? How are they using water? How do they transport water? And so they by truly deeply understanding the population, they could then come up with solutions that an engineer in a lab in Austin or in MIT or Stanford is not going to come up with. And so if you apply the same principles to health and healthcare, putting the patient at the center, putting the community, Austin and Travis County at the center is critical, and design is a big part of that, and I think goes hand in hand with communication. With communication of understanding how do we best listen to people, what are their needs and wants and preferences and likes and desires, and then how do we message them in ways that are meaningful to them? Not just how do we message them, but what kinds of messages will be meaningful to them? How will we cut through the clutter of all the noise and all the messages and all the anti-health messages that exist with information that people can use? And that truly is kind of one of the real expertises of area of health communication. So I think with this new Design Institute for Health and our Center for Health Communication, I can imagine dozens of potential partnerships of things we might do together.
Yeah, it's exciting. We're sitting here at South by Southwest. It feels like Austin's kind of the epicenter of the universe at the moment. The energy here is incredible. And I can actually say that's what it feels like at the Dell Medical School, is we really have this opportunity to start something from scratch. It's very much like, the right people at the right place at the right time. But it makes me think about the same for you guys and what you're doing with the Center for Health Communication. Can you talk a little bit about kind of the vision behind that?
Sure, and I'll say that my friend texted me earlier today to say that South by Southwest and Austin were trending topics on Twitter right now.
Right, no doubt.
So maybe we are, for at least the day, the center of the universe, at least the online universe. I'd be happy to. Our Center for Health Communication is brand new here at UT, and we're really we're probably already the largest and most comprehensive center for health communication in the country at an academic institution. We have about 30 faculty from all over campus, certainly faculty from communication, but also from nursing, social work, engineering, medicine, and from all over campus. And we are doing research and have programmatic expertise in developing partnerships in the entire range of the health communication world. So that certainly includes clinical care and healthcare. We kind of connect the dots and run the gamut from healthcare to public health, as well as from interpersonal communication and message development, all the way through mass communication and campaigns. We have a really breadth and depth of expertise, and our goals are really not just about doing research and not just about developing training programs, but it's about improving health. So much like the Dell Medical School, our mission for the Center for Health Communication is improving health for people in Texas, in the United States, and around the world through leadership and excellence in health communication research, education, programs, and partnerships. And so we see our work in all of those domains. Partnerships are certainly something we've been talking about and building right now, but it's also about training. We're developing training programs because there are so many health professionals who need to be better communicators.
Yeah, it's true.
But we're working with Dell Med and other med schools about ways to better train clinicians so that they're better listeners and better communicators, but we're also looking at how do you train health professionals in all different sectors, nurses and physicians and informaticians, and how to be better health communicators, because that's a big problem we have in our system, is the disconnect between people's ability to access and understand health information and the way that information is currently being presented.
No, it's true, and there's such an opportunity. I'm glad you mentioned the point about this is all about improving health. One of the things that Dean Johnson had said that really resonated with me is, like, we're going to be measured not by the size of our buildings or our budgets, but by the health of the community, and that's really what we're all about.
And similar for us, we're a pretty unique academic center at UT outside of medicine with having a mission like that. So that our mission, it really is about improving health, and we'll judge our success, and others will judge our success over time by how many lives we've touched and how many people's health we've been able to improve through better health communication. Yeah,
and it's interesting as I think about kind of big picture, we're talking about making Austin a model healthy city, and I think both of us would agree that health communications is a key part of that. And in fact, I'd like for UT and for the Dell Medical School in particular to be seen as a place where we've done the community engagement right, we've done the community part of this right, because it's absolutely at the heart of it.
Yeah, I think to become a model healthy city and a model healthy community is all about engaging the community. And that we can have the best experts in the world working with us, and we can have the most eloquent solutions, and just beautiful buildings and great data. But if we're not really engaging the community and helping the community reach their potential, we're not going to be the model health community. The model health community, I think what I like best about what I've heard about the proposed concept behind the ecosystem is the word inclusive. And the notion that it's an inclusive model. Inclusive means everybody is part of the solution, everybody's ideas matter, and that everybody will be part of making Austin and Travis an example for other cities and communities to follow and learn from and build on.
Yeah, exciting stuff. Thanks for being with us here today.
Thank you, John. Great to be here.
Great.